Hi, everyone. Thank you so much for being here for our webinar series. I want to give a chance for Raul from Interpretation to let folks know how to get hooked up with Spanish interpretation.
Yeah, hello. Buenas tardes. Si necesita interpretación al español, con mucho gusto está disponible. Vaya a la parte de abajo de su pantalla, presione el globo terráqueo y escoja ahí su lenguaje, en este caso el español, y va a ser enviado directamente a la sala de interpretación. Si está en su teléfono, en la parte de abajo hay tres puntitos. Presiónelos y ahí va a poder seleccionar su lenguaje español. Ahí nos vemos.
Wonderful. So thank you so much for coming, everyone, to our November parent webinar. My name is Haley Figueroa with the DPS Substance Use Prevention Team. I'm really excited today to welcome my two colleagues, Maria Height and Nahal Kalabari, who are going to be here to talk with you about some tips to talk with your kids about substance use. So Nahal and Maria are on the substance use prevention team. Nahal is a DPS school psychologist, and she works currently at West High School in Grant Beacon. She also has a wonderful therapy dog named Sprout that visits schools with her. And Maria is a school social worker at LCSW, and also currently working towards her licensed addiction counselor certification. She's currently at Skinner Middle School and Hamilton Middle School. So these two of our staff are funded by the Denver Opiate Abatement Funds and out there in our schools every day doing prevention and intervention work with our DPS students. So very excited to welcome them and introduce them. And then they will be sharing some slides and a presentation for about 30 to 40 minutes, which we will be recording and also sharing out both on our website, and you'll get an email tomorrow with that as well. And then at the end of the presentation, there will be a time for question and answer. So please use that question and answer button located in Zoom at the bottom of your toolbar for any questions. So hand it over to Maria and Nahal.
Great. Hi, everyone. And thank you for coming today. We'll go ahead and get started if I can get clicked over to our next slide. And so, goals for today. We'll be discussing some trends in current youth substance use, and then also just general use. And then also we'll talk about risk and protective factors, warning signs. We'll also discuss learning skills on how to talk to your child, or to the teen that's in your life. And so here on the screen is a graph from our Healthy Kids Colorado survey. And you can see throughout the years here, we're actually slowly seeing a decrease in use. There is some concern that our survey pool this year was a lot smaller than years past. I have hyperlinked a Chalkbeat article that discusses the Healthy Kids data and then also the Healthy Kids data dashboard. If that's something you want to look into, there is lots of great information related to substance trends, mental health trends, and then also the NIH article I have linked discusses national trends, and we are generally seeing a downtrend in substance use at this point in youth, which is good news. Next slide, please. And so this is a graph from our Healthy Kids data survey as well. This sample is Denver High School and Middle School. I'd like to point out that alcohol is like the highest used substance still reported. And then following or for high school, THC and nicotine use, vaping nicotine are second highest. Something that's kind of interesting, if you notice in the kind of like pinkish reddish color, middle school has a higher identified use for vaping and then also a slightly higher use for cigarettes. So some really kind of interesting information. Nahal and I provide prevention uh, push-ins or classroom education related to this. And for example, I'm working in two middle schools where I've provided prevention education related to vaping nicotine and THC. Next slide. And so, like I mentioned earlier, alcohol remains the substance used most by teens. Kids who begin drinking before age 15 are 4 times likely to develop alcohol dependency than those who begin drinking at age 21. And this information is provided from Rise Above Colorado, a partner nonprofit that we work with, and they also create fantastic curriculum. Next slide. And so, nicotine, tobacco, vaping, and e cigarettes. E cigarettes are the most common tobacco product used by youth. 80% of adult smokers start in youth as well. My Life, My Quit provided some of this information, and they also have a fantastic call line and text line to help young people quit using nicotine. Next slide. And so vapes are getting really complicated nowadays. They are getting sneakier and sneakier. There's all sorts of different ones. This picture depicted here is from our partners Catch My Breath, another curriculum that we use that focuses primarily on vaping nicotine. And you get all sorts of different things. All sorts of different types of vapes that can look really discreet or can be hidden really easily. And so it's just something to kind of keep an eye out and be aware of. Next slide. And so, along with vaping nicotine, we are seeing a huge uptick in or excuse me, we're seeing an uptick, we've seen use of vaping nicotine, but when we now are seeing other nicotine use, like these nicotine pouches called Zyn, Velo, and On, and then also Knick Knack. These are all very small, somewhat like white pouches, excuse me, that can be put into the cheek of the mouth, and that is how the nicotine is absorbed. It's very discreet, it can be hidden very easily. And so, again, something to keep an eye out. There's a lot of events out nationally where this nicotine product is given out for free, for example. And so it's gaining more and more popularity. We also are seeing aromatherapy vapes. And now, aromatherapy vapes commonly do not have any nicotine in them, but there are harmful chemicals and compounds that are still not good when anyone inhales and consumes. We are also seeing now nicotine vapes with video games on it. The picture that I have depicted here, these vapes can actually be found on the internet for like $15 a piece before tax. And so very concerning, and it also just highlights how much like big tobacco is trying to target young people, in my opinion. Next slide. And so galaxy gas, or better known as nitrous oxide, or there's been slang terms used like this is something that was trending on TikTok a few weeks back. That has I've heard in my day-to-day life young people asking about this, wondering about it. I have some hyperlinks identified here. There's a Morning in America clip that I think conceptualizes this concern really well. But also I have a CNN health article, and then also Yale published a study identifying. And so the really concerning thing about galaxy gas is it is a product that's supposed to be used to make flavored whipped cream, but young people are inhaling it and getting a somewhat of a high from it. There are some serious health concerns related to it: loss of consciousness, heart attack, loss of coordination, headaches, nausea, vomiting, seizures, brain damage, amnesia, nerve damage, being paralyzed, vitamin B12 deficiency. Dependency on it, and in some cases it can cause fatalities. And so this is really concerning, and something that, if you were a person out in the world and didn't know this was trending on TikTok and becoming kind of a thing, you might not know that like this type of whipped cream canister might be a sign that a person is consuming this in an unhealthy, non-recommended way. Thank you. Next slide. And so cannabis is concerning for youth because it impacts learning, brain development, and driving, mental health, and is risk of addiction. High potency THC, like dabs, edibles, or in vapes, those cartridges, many though that's primarily what we're seeing being used. And many youth report smoking weed to help cope with trauma and mental health challenges. The concerns of high potency THC, um, the higher the potency, we're seeing a trend in it affecting mental health even more seriously. It also is not recommended for anyone under the age of 25 to be consuming at this point. Next slide. Fentanyl and opioids. And so fentanyl is a deadly synthetic opioid being made into fake pills or cut into other street drugs. Fentanyl is 50 to 100 times stronger than morphine, and many people are unaware that drugs are laced with fentanyl. Just recently, the DEA updated their website. 5 out of 10 pills on the street contain fentanyl. U.S. overdose deaths have decreased, generally speaking, if you've been watching the news on this. First time since 2018. But when we compare Denver overdose deaths, they're still on the rise at this point, even though national deaths are dropping. I have a DEA website linked in this slide. That website can be extremely helpful. Lots of great resources on it. And then I also have a CDC article and a Denver News article discussing the overdose rates. Next slide, please. And so some fentanyl specific resources is the Drug Policy Analysis website has a lot of great information to help facilitate and provide like real factual information to teens. And then we also have another hyperlink that identifies tips on how to talk to your kids about fentanyl. Um, there's examples of how to talk about it as well with the link below dropping the F bomb. And then Parentship to End Addiction also is a hyperlink that identifies parent prevention tips for kids of every age. And so lots of good resources. And so we've discussed all the trends. Let's talk about what can help or hamper young people at this point related to substance use. Next slide. And so some of the risk factors are family history of substance use or addiction or overdose, favorable parental attitudes towards the behavior, poor parental monitoring, parental substance use, family injection. Rejection of sexual orientation or gender identity. So, having unaccepting or excuse me, I apologize, getting a little nervous, but what I'm trying to say here is when a parent is not very supportive or rejects a student when they are coming out or trying to understand or identify gender identity or sexuality orientation. Another risk factor can be associated with peers, the student or teen's peers using substances, having a lack of connectedness at school, low academic achievement, childhood sexual abuse, and then mental health issues are all risk factors that could make a teen more susceptible to substance use. And this source is from the CDC. Next slide, please. And so some protector factors are parents and families being engaged, providing that family support, parental disapproval of substance use, parental monitoring, and school connectedness. These are all things that can really like build and create a protective environment for a student or teen and help them not use substances. Next slide. And I'll hand it off to Nahal for the other half of the slides. Thank you so much for listening.
Thanks, Maria. So here we have some of the things to look out for with your child, how you might be able to notice that they may be starting to experiment or maybe even going beyond experimenting into more frequent use. So as you look over here, they are organized into individual behavioral and physical signs. Some of them might be more obvious, like smelling like alcohol, smoke, weed, or vape flavor, that strong fruity or minty smell that you might notice. Some of these other ones could be attributed to just general changes in adolescence or other mental health concerns like being avoidant or increasingly anxious, irritability and impulsivity, withdrawn or not communicating. As I said, some of these might be considered typical behaviors for teens. So, as a parent, you know your child best and listen to your gut, follow your intuition. If you're ever unsure about some of these, you can always check in with your child's doctor or maybe a mental health provider at their school. Some behavioral things that might be noticed are truancy or tardiness, going out frequently, locking their doors, being more secretive. Obviously, a decline in grades could be indicative. And then, as far as physically becoming sick a lot, substance use can impact the immune response, changes in weight, changes in sleeping patterns, bloodshot eyes, dental health issues, issues with upper respiratory infections or bleeding or sorry, breathing, or things like nosebleeds. And again, these are just some things that may tip you off that something might be going on, and you may need to have a conversation or expand the conversation to include other people in your child's life. And so, with this, a big um, focus of this webinar is how to talk to your children before you even notice these warning signs. When to start the conversation is to start those conversations early and continue to have them often. So, where to start? It can be a challenging thing to start this conversation. So, we know it's not going to necessarily be the easiest conversation you'll have with your child as a parent. And starting that conversation early kind of sets the stage for that to happen throughout their developmental years. Taking advantage of teachable moments, such as in movies, TV shows, celebrities. And when they ask tough questions, answering them simply and honestly, sticking to what you know. If they do ask something that you don't know the answer to, it's perfectly fine to say, I don't know, and I will find out and get back to you, rather than maybe giving misinformation just so that you can answer in the moment. And really focusing on having like a discussion based conversation rather than lecturing, because that leaves little room for them to practice their refusal skills and their critical thinking. So here we have a Brene Brown quote. First and foremost, we need to be the adults we want our children to be. We should watch our own gossiping and anger, and we should model the kindness we want to see. So this can apply to both substance use and beyond, with really being that strong, positive role model for your child. How early is it too early to start having these conversations? Some people think that maybe elementary age students, it might not be appropriate developmentally to start having those conversations. And really, what they're finding is as long as you're using age appropriate language, it's never too early to start opening up those conversations. With how much kids are exposed to things on the internet, they are probably hearing things regardless in the upper elementary years. So to be able to start those conversations from like a factual and like within a safe space in your home is really important for your child to have. And so parents have a significant influence in their child's decisions. We know that peers do as well. And as parents, you are a very important influence in in their lives and on those decisions. Some research has found that kids who start drinking young are 7 times more likely to be in an alcohol related crash and just more with general substance use because of the way children and teens' brains are developing. The younger they start using, the more likely they are to develop an addiction later in life. Oh, sorry, could we go back to that last slide? Thank you. There are some misconceptions out there that maybe talking to a child about substance use before they're exposed to them might put the idea in their head or might add to their curiosity about it. And kind of similar to the idea of like talking to someone about suicide is not going to plant the idea in their head, the same thing applies here. It really is better to talk to them before they are exposed, because this comes from SAMHSA. Children as young as 9 years are already starting to view alcohol in a more positive way. It is still very socially acceptable. And about over 3,000 kids as young as 12 are trying cannabis each day. And as we are working in middle schools, Maria and I are definitely like seeing this in our work. And not talking about alcohol and other drugs does still send a message. So some tips for communicating with your child is listen more than you talk, again, avoiding that kind of lecture approach. Asking them open-ended questions that promote independent thinking. So really like an opportunity to gauge what their opinions are, what they are already thinking, and having that like critical discussion opportunity. Be specific with your praise when you are praising your child. And using I statements, we'll give a few examples of those. If your child is experimenting or using, focusing on criticizing the behavior, not necessarily criticizing your child directly. And with that, maybe waiting to have the conversation if you are finding that your child is under the influence, not necessarily having those conversations in the moment, waiting until they are no longer under the influence, and then they can actually use those skills for critical thinking, and they'll probably get more out of the conversation. Try not to discount their feelings and show respect for their opinions. And remember that respecting does not always mean that you are agreeing with their opinion, but you're showing respect for their ability to build their own opinion. And when they are ready to talk, being present, dropping everything, including your cell phone, really giving this important topic your full undivided attention. So some of these stems for using I statements when you're talking to them. I care, I see, I feel, letting them know how it makes you feel. I'm listening, phrasing the things that you would like them to do as I want and I will, as far as any agreements that you would like to make for them. So this is a frequently asked question. What if they ask about my own drug or alcohol use as a teen? And this is something that we experience too as we're going into classrooms and teaching students. So what experts recommend is not to lie if they ask, and also don't volunteer the information. Stick to facts and definitely avoid glamorizing or telling long stories. There was a study through the University of Illinois that found kids who said their parents had talked to them about drugs were more likely to have anti-drug attitudes. But out of that same study, those students whose parents' conversations had included their own past drug use, those kids were more likely to say that using drugs wasn't such a big deal. And then it's important to consider if they're asking about like your current use in the moment, or if they're asking about your past use, like when you were in high school or college, did you try these things? And we have a few ideas and examples on the next slide. So if they are asking about your current use, this can be challenging. Like if you're having a conversation with your child about vaping, and if that's something that you are choosing to do, consider what you are hearing from your child and how they might be feeling about your substance use. And that would feel more empowering for them versus saying, I'm an adult with a developed brain and can do what I want. While all of that is true, kind of hearing how they're feeling about it and how it could be confusing for them. And then if they're asking about your past use, and an example response, obviously, like, this is your choice and like say what feels authentic to you. But some ideas are that if they ask you, like, if you used in the past, you can say, so if I say I did it, then that validates your choices. And then it makes me sound like a hypocrite. And then if I say I didn't, like, you might think that I don't understand you. So kind of turn that focus back on them because that is where the conversation is. Like, I really want you to focus on your choices, how they're affecting your life, and if it's conflicting with your goals and values. And that kind of helps steer the conversation back to what they're doing and how it isn't really necessarily related to what you did in the past. So once again, having a trusted adult caregiver and a close relationship is a highly, highly protective factor for early substance use. And talking to them leads to that building of trust. Knowing this will be a series of conversations, so finding opportunities for little conversations, maybe during car rides or meal times, rather than putting the pressure on having this like one big conversation. When you do talk about alcohol and other substances, make your views and rules clear. Lead by example and practice what you preach. Modeling for them is one really strong way to prevent their substance use. And then having that two-way conversation, hearing their point of view, having an opportunity for them to ask questions, and then listening to their concerns as well. So, Teen Intervene is one of the interventions that we use with students who are in the beginning stages of substance use. And here are 5 things that they recommend to help your child avoid alcohol and other drugs. Parental monitoring is really important, knowing the general whereabouts, who they're hanging out, when school is out for the day, what they're doing after school. Again, that appropriate role modeling is really important, can't be overstated. Building a warm and supportive relationship, having that close relationship where they feel like there's a safe space and they can talk to you about things, and establishing appropriate parent-child communication. And then again, knowing their peer relationships because that is such a strong influence on them as well. Another general tip is finding ways to build in some of those protective factors that Maria had mentioned in support of these conversations. Having fun together as a family, supporting your child's interests, engaging in healthy activities so they have some of those alternative coping skills. So overall, our takeaways here is that actually most Colorado youth do not use substances, and that is something we really try to emphasize while we're teaching lessons in schools is this positive norming. A lot of times, especially depending on who their peer group is, they feel like everyone is doing it, and that is not true. So focusing on how if they are choosing not to use substances, then they actually are in the majority. Um, Again, remembering those risk factors and warning signs. So be aware of your child's behaviors, their friends, their activities. That's the number one way for you to become aware of a problem in the beginning stages rather than once it has kind of progressed to more significant use. Knowing the importance and this is a big thing that you as the trusted caregiver can be the most significant protective factor against their early substance use. And then taking the steps, and we know it's not easy, but having that conversation early and having those conversations often will have create that safe space for them to share their concerns and curiosities. So we've linked in some of our substance use treatment resources here. Denver Health has the STEP program and some of our other community agencies that can support as well when it goes beyond maybe what we can provide at the school level. And then some general mental health resources that we have access to as well. And that is all that we have. So we'd love to open it up for any questions at this point.
Yeah, it looks like some are coming in through the chat for you all. First one, what do you do if they ask you questions you don't know how to answer?
So for that, I would recommend being honest and vulnerable with them. Like I don't know the answer to that. And like saying like I would rather like take the time to kind of do some research or maybe consult with some other people so that I can give you accurate information, helpful information. So if you're okay on putting a pause on that, then I would love to come back to that when we can actually discuss it more fully and just being like vulnerable, like I don't have the answers to everything. Like there's still things that I'm learning about, especially if it's something with regards to vapes or fentanyl. Like this is like a new thing that's around that maybe wasn't around when you were a teenager. So like we're all kind of learning about these things and how that is kind of part of the concern with vaping is it just hasn't been around long enough to really know what the long-term effects are. But just in general, I think being honest with them and kind of waiting until you have the information, and that shows them that you care about making sure that you're giving them the correct information that will help them with making their decisions.
Great. Another question, should parents never drink in front of their kids like a glass of wine or beer?
I would say that you are a legal adult that is allowed to consume. I think within moderation and within safety. And though I that is, but you also don't want to be so inhibited that you cannot be a parent and things like that. But that is a gray area that you have to decide as a parent. What to do, but we did talk about like modeling behavior, and so this is an opportunity that you can model good behavior with alcohol use. And please, Nahal or Haley, if you'd like to add more to that.
Yeah, I love what you said, Maria. I think just like making that, you know, understanding like why is it illegal for youth and why, is it legal for adults? So really helping our kids see that, their brains are still developing and that this behavior obviously is a risky behavior and could put them at risk. So I think you nailed it. I would love to ask each of you just to think about a young person that you have worked with that you were able to see sort of turn the corner or turn around, based on your interventions, like just anything that were significant for this young person in, being able to change behavior or being able to decrease their use or stop their use.
Yeah, and so that's one thing that's really wonderful, I think, compared to like working maybe perhaps with adults that are like the brain is fully developed and there's more concrete thinking, more set in their ways, where teens and adolescents are just have the ability to absorb so much information. They are curious. They're willing often to listen to you. I've had some wonderful experiences just talking through with our teen intervene intervention. There's a pros and cons worksheet that we work through together, and that's where I can often plug in lots of good like facts that the student may or may not know. But the way the activity is framed, it helps the students actually kind of problem solve on their own, and it's a nice practice to use like how to use a pros and cons list. Like it's not just for substance use. It can be used for other decision making skills, and I've watched that turn a student from like I don't have a problem to actually considering like maybe this is really harmful to my mental and physical health. I do want to limit or quit use. And so it is really like so powerful.
Love what you said, Maria. I think that, we can all lecture kids or like tell them it's wrong, but I think also helping them see like what are their goals and, what do they want to change? So like engaging them in the process, right? If you think about adolescence, right, it's all about autonomy. And so I love that approach. Nahal, are you thinking of any students or young
Yeah,
people?
I'm thinking a little bit more in a general sense, just empowering them with education when we go into classrooms and teach students about vaping and cannabis. Um, we really start by framing the lesson as like this is meant to be educational for you and information for you to take and use to make your decisions. And I feel like that feels really empowering for them rather than coming in like I'm here to like tell you not to vape. Which is what I hope that the lessons will that is the outcome, but framing it in the way that like this is information for you to use when you're making your decisions, and kind of seeing their eyes open when you put up on the screen like all the different chemicals and heavy metals that are in the vapes, and that leads to a lot of discussion around like why are they putting this in the vapes, like, and then seeing too sometimes when I have students who are in those lessons and I'm also working with them individually, they will like definitely take that information and without me even prompting they'll bring it into our sessions together, and it really leads to like rich discussion, and you can see the gears turning once you give them the information that the tobacco companies are hoping desperately that they'll never find out about.
I've also noticed when doing classroom education, we provide surveys, and a lot of the responses of like I'll ask an open-ended question of like what was the most helpful, and often it is like actually getting to know the facts about this stuff, about substances. So I think being open with the like evidence-based information and providing that autonomy, but also like giving them the facts and not just saying like, well, just don't do it because I say so, can like really help students like let that information sink in and help with decision making.
Love about both of you working in schools is you are mental health providers, and we know that most students that are struggling with substance use, right? Oftentimes they have a co-occurring mental health condition. Do you want to talk a little bit about kind of what are some strategies or ways that you work with your students around, those sort of mental health building tools or skills?
I like to
Oh, so
Oh, go
sorry.
ahead.
Go ahead. No, you first. Oh, okay. I would say one thing that always incorporate is helping students find alternative um, activities, behaviors, things to replacement behaviors from the substance use. And that can be incredibly helpful. And that can look from drawing, creating art to mindfulness exercises, listening to music, incorporating more physical activity in their lives, making sure that their basic needs are being met, to that they're am I drinking enough water, eating plenty of food, getting enough sleep, that can help curve cravings. But sorry to interrupt you, Nahal.
No, you read my mind. That's basically exactly what I was gonna say, like, making sure that their tool belt of coping skills is built out, which can help them with finding, like, alternatives to substance use, but then down the road, like, any kind of stressors or, like, life events that might be impacting them, then they have kind of those healthier skills to turn to.
Such great advice. And you all are such a gift to the DPS students. And I know as a parent myself, other adults are so important and huge in kids' lives. So thank you so much, both of you, for all the amazing work you're doing. And thanks to everyone who attended.